Do you have pain and stiffness in your shoulder joint? Just because of it, are you unable to comb your hair or unable to dress up or undress yourself? Then it might be a frozen shoulder. Frozen shoulder, nowadays it is a most common problem seen in middle and elderly aged population, especially in females and those who are suffering with diabetes, thyroid diseases and cardiac diseases. Over 3% of the adult population in a lifetime might get frozen shoulder. Frozen shoulder, what is frozen shoulder? Frozen shoulder is a condition where there is a pain and stiffness in your shoulder joint. Coming to shoulder joint, it is covered and stabilized by a thick fibrous capsule and ligament. This thick fibrous capsule over a period of time starts getting thickened, even though the cause of this is not known yet. Frozen shoulder develops in 3 stages. The initial first stage is known as freezing stage, where there is a slow onset of pain and over a period of time, the patient will start developing gradual stiffness of the shoulder joint. The duration of this stage might vary from 6 weeks to 9 months. After this freezing stage, the patient might go for frozen stage if they doesn't receive any adequate treatment in the initial stage. During this stage, the pain slowly starts improving, but the stiffness persists. Because of this stiffness, all range of movements of your shoulder joint gets compromised. The duration of this stage might vary from 4 months to 9 months. Then coming to the last stage known as thawing stage, where the patient doesn't have any pain at all, and the stiffness also gradually starts improving. Even though this frozen shoulder is a self-resolving disease, it might take 2 to 3 years or more than that to resolve. Some practitioners might ask for X-ray and MRI of your frozen shoulder joint to rule out other causes of your pain for the shoulder joint. Initial days, people used to opt for surgery to get rid of these symptoms. Nowadays, the medical field has advanced a lot. So, in order to avoid the risk and complication of the surgery, you can opt for hydrodilatation of your frozen shoulder. In this, we are aiming to control your pain and restoration of all of your joint movements which was compromised before. In this, the pain physician under the ultrasound guidance going to inject anti-inflammatory medications with large amount of fluid into your shoulder joint under the capsule with a real-time image. During this hydrodilatation, where the fibrous capsule which was tightened before starts getting stretched out, which gives you an immediate relief from the frozen shoulder.